This is Tom Gamble of In-Game Sports, and I'm here today with Dr. Michael Chen from Mercy Health Orthopedics and Sports Medicine. He's an orthopedic surgeon specializing in sports medicine, and we're here at Winton Woods High School at their beautiful football stadium, where Dr. Chen is the head team physician. Good afternoon, Doc.
Good afternoon.
Perfect day, right?
It's beautiful.
Play a couple today if we could.
Wish we could. Better than tomorrow, probably.
Absolutely. That's probably not the case. But, Doc, let's talk about, for those who are unaware, a head team physician. It sounds important because it is, and I know you work closely with all the certified athletic trainers from Mercy Health. Talk a little bit about what it means to be the head team physician here at Winton Woods.
So it almost kind of sounds like what it is. Like, you're the physician for the team. You're responsible for both their medical aspects, but me as an orthopedic surgeon, my specialty is really taking care of all their orthopedic needs. I'm fortunate to have another doctor with me who's a primary care doctor to actually help me out with all their medical stuff. But anything from helping athletes during the middle of the game to check them out, make sure and see if they can come back to play during the game, or even in the middle of the week if they had injuries, I'll see them in the office, try to get them diagnosed, get them treated, to try to get them back on the field as soon as possible.
Now, the one thing, I know this doesn't have any real bearing on you being a team physician at a certain school, but you've seen a lot of good Friday nights here at Winton Woods. I mean, it's got, that's got to be something that, and here we are entering week 9. Winton Woods still alive. They were the number 1 seed in Division II, Region 8, undefeated, having another great year. I got to believe that makes it a little easier when you're typically on the winning sideline, right?
Honestly, that's probably the best part about this job, being on the sidelines, and then when you have a great team, seeing some great athletes, like you mentioned, the last couple of years. I mean,
wow.
Last year we had Mayan Williams, and we've had some really great kids go on to play Division I football too.
Well, let me ask you about this year because it's been anything but a normal season. I know with obviously up in the air about would there even be a fall sports season, a very shortened preseason. Now we're this far along. What have you seen based on the limited preseason? Have you seen less injuries, more injuries, and if so, in what areas?
Fortunately, I don't think I've seen any more in my own personal experience here, but I don't think that specifically has affected us in terms of injury risk. They still had a training camp beforehand, and there's been studies that have shown that whether you have limited practice beforehand or not, specifically looking at the NFL, I think it was early 2012-13 when the collective bargaining agreement came out, and when they cut down practice time, OTA time. They looked at a study looking at that, whether before that time and after that time for a couple of years, did they have more injuries after that, and it didn't. So I think fortunately that's played out for our high school athletes here, that it hasn't affected us as much. Knock on wood. We want to keep going, keep our athletes healthy though.
Sure, and you obviously do more than just football. They have a number of fall sports here at Winton Woods. What have you seen, and what was some of the advice that you and the trainers gave to the student athletes and the coaches, knowing that it was a different preseason and knowing that it would be a little bit limited, no scrimmages, for instance, in football, and all of a sudden you're right into playing games? What was some of the advice that you passed on?
Well, with that too, though, since there is a limited preseason or less scrimmages, you want to be preconditioned before the season. So you want to be ready, work up. You don't want to start from going 0 to 100. You want to get that preconditioning done beforehand to be ready for the season. And then now, especially with COVID, this is a completely different animal than from years past, where in terms of social distancing, we've done a very good job here in Winton Woods in terms of all the recommendations from the CDC in terms of how we treat the athletes, how we interact with the athletes. The coaches and the players have done a good job, week in and week out. And then especially now, staying on the field. We're in the playoffs. We want to stay in the playoffs. We've seen many teams already had to forfeit because of that. So I've told our athletic trainers, our coaches, our players, you've been doing a great job so far. Keep up the good work, especially maybe not just here at school on the field, but when you're at home, when you're out in the community too. You
bring up something interesting. I had one coach tell me about that kind of preseason where you have to do it on your own, the student athletes. He goes, yeah, you know how the 20-80 rule applies. And he goes, and here it's probably 80% are doing what they shouldn't be, where the 20% are staying in shape. But I wonder how much at a place like Winton Woods, at a program that's accustomed to winning, not just in football, but a really good athletics program, if in fact kids said, hey, when we get back to it, we want to make sure we're doing all the things that we need to be doing.
From what I've heard from some of the players, it sounds like a lot of them have been doing a good job. They did socially distance, have virtual meetings, have virtual workouts and stuff like that. So I think a lot of schools have done that, though, and that's a credit to both, the athletic trainers, the coaches from all the different programs, around the city, but also to our own coaches here too.
I want to ask you too, and this isn't necessarily your specialty, but I know you're on the sidelines and you see and talk with the student athletes. I know it's been a difficult year, and nobody's hardly in school every day. And I know people talk a lot about mental health and making sure that kids who want to be kids and go to school. How have you seen the attitudes of the student athletes here at Winton Woods? Because it is so different from what they're accustomed to.
Oh, for sure. And even before the season started, we were all very big proponents and supporters of we want to play. I think sports, I agree, is a great thing for kids and for their development. So I think it's very important. I'm glad that we've been able to have a season here in Ohio too. But yeah, I think most of the kids are all very enthusiastic, very happy to be playing. We're very happy that our season is still continuing right now. I think we moved a little bit. Is that okay? Yeah.
All right, so Doc, I know coaches have a lot of superstitions. Players do too. As the head team physician here at Winton Woods, do you have any? Is there something that you find yourself doing the same way every Friday night, like not stepping on the white line, sitting on a certain part of the bench, anything like that?
No specific superstitions like that, but obviously, as a surgeon, I'm here doing pretty much the same thing, getting set up before every game as usual.
Now, what about like a pregame or postgame meal? Do you have a same place you go to?
One of my postgame meals, though, because we finish maybe sometimes later at night, is actually Skyline.
How did you know? What a perfect answer for the Skyline Chili Crosstown Showdown. And right down the street here from Winton Woods High School, the Forest Park Skyline, Stan Townsend, a great proprietor. So now when you go to Skyline, is it the same thing? Is there a go-to for Dr. Chen, or do you mix it up?
I do have a go-to, and it's actually a friend of mine turned me on to this, which is not really a specific menu item. It's the Chilito with spaghetti in it with insane cheese.
All right, so we're putting spaghetti in, putting a little habanero in there, spiking it up a little bit. So there you go. So that's been good luck. So you may want, I don't know whether you're into this, but you may want to turn that into your pregame meal just to bring the Warriors a little luck.
I don't know if I want to mix things up, though. That's a little superstition.
Oh, there you go.
There.
Okay, there's your superstition. So after Friday night, we'll meet you at the Forest Park Skyline Chili. How about that?
Sounds good.
Now, I'm with Dr. Michael Chen, who's the head team physician here for Winton Woods High School. He's also an orthopedic surgeon specializing in sports medicine. And by the way, hit up mercy.com/ortho to schedule an appointment for more information about how great docs like Dr. Chen can take care of you. They got a great team at Mercy Health, but I'd be remiss, this is where we get into some of the background of the doc here, right? So you're from Louisiana, but you've spent more time in the Midwest right now than anywhere else.
I went to college and medical school at Northwestern in Chicago, then did my orthopedic residency in Cleveland for 6 years afterwards. Spent 1 year doing my orthopedic sports medicine fellowship at Stanford out in California. Then I've been here in Cincinnati for 9 years, and I've been the team physician here at Winton Woods for about 8 of those years too.
So you obviously had to go way down your college admission entry list, right, to get in some of those. I mean, I can't imagine what you were denied access to. Those are some good schools.
Exactly.
But let me ask you, you mentioned that, and we were just talking kind of before this, and you mentioned you spent those years in Cleveland, and I'm sure you get a brunt of people from Cincinnati getting on you with the Cleveland jokes, et cetera. But it's unbelievable how we were talking about, hey, Cleveland's not that bad after all, is it?
It's a great place to live. I lived there for 6 years. I loved it. But yeah, you're right. It's the Battle of Ohio. So, but the weather's better here in Cincinnati, though.
So let me that is. So let me ask you this. So the Big Ten Conference and the Pac-12 Conference, I know both you spent time in both of those.
Yeah.
So this last weekend, the Big Ten got underway, and I guess are you happy to see some of the football teams and some of the? I know it's been a really difficult time for student athletes at all levels because of COVID, and I'm glad to see people being able to get back to their sports and hopefully do it safely, which I know you guys at Mercy Health are really focused on that aspect of it. But to be able to play, and when you look at somebody in their senior season and think that they may not have that, that's pretty painful.
I can't imagine what that would be like. Fortunately, we're looking at the data, we're looking at science. We've done, good we follow along with what the CDC recommends. So, getting started up, doing good testing. We've seen some good results out of the NBA, where they were very vigilant about that. So hopefully it'll be very good for the Big Ten too.
It's a shame that every sport, including high schools, can't be in a bubble, right? Because the bubble seems in all those professional leagues, and obviously you can at high schools. So I'd be remiss if I didn't ask you, Winton Woods this year, are we making any predictions? Are we? I mean, we're getting, each week one step closer. They're the number 1 seed in Region 8. They've been pretty dominant all year long. Projections, Doc?
I'm not a coach, but I'm going to probably talk like a coach. I'm hoping they're taking it 1 week at a time.
Oh, yeah. Well, let me tell you, sure you've never coached before? Because you sound exactly like a coach. Don't look past Friday, one game at a time. This team is a team that we need to make sure I get it. So you've been listening to coaches, right?
For sure.
Whether you want to or not, sometimes probably. But Mercy Health is a great partner of the Skyline Chili Crosstown Showdown. And be tuned in to @Xtown Showdown all week long as we'll have previews of the game. We'll talk to coaches, we'll talk to players, and we'll be out here Friday night. Maybe we'll hit up Doc for a little interview on the sideline because we do a little before kickoff, halftime, and a little post-game recap. So appreciate your time. Thanks for joining us, and we'll see you out here Friday night.
Thanks for having me.
Dr. Michael Chen of Mercy Health Orthopedics and Sports Medicine.